My name's Associate Professor Scott Clark, and I'm a consultant psychiatrist that works across the Queen Elizabeth Hospital and the Western Community Mental Health Service. And I'm the head of the Discipline of Psychiatry at the University of Adelaide. So one of the key focuses of our research is the atypical antipsychotic clozapine. So clozapine works in 30% of cases where no other drug works for treatment-resistant schizophrenia. So without clozapine, they face a life of hallucinations, delusions, and the distress associated with that, and poor general function. So with clozapine, many people return back to a normal life. They're functional and they work day to day. There are a range of side effects. The most common is a granulocytosis, which is low white cell counts, which can result in severe infection. But there are a range of other side effects, such as seizures at high doses. There is myocarditis, heart inflammation that happens in the first 3 months. And we really don't understand why these things happen, and we don't understand why the drug works. And I guess we're trying to pick apart the biological mechanisms while also measuring the events in service data to try and improve our ability to intervene. So over the last 10 years, we've developed detailed monitoring protocols based on pharmacy advice, based on the drug manufacturer's advice, but also based on our own observations. And we've fed our research, local research, on the outcomes back into those guidelines and really have set the benchmark both nationally and internationally. We are now building alerting systems that are automated to let the treatment team know when people are admitted to hospital, and that way we can reach in, because there are a lot of do's and don'ts with clozapine management, like stopping early or restarting at full dose, and people can end up very sedated. So to evolve from that system and to look at a real-time system linking all the different data elements together, we've instigated weekly troponin cardiac enzyme measurements and inflammation measurements. And that data would be gathered in real time, and the numbers crunched, including all risk factors, and then an alert provided if an emerging inflammation of the heart, myocarditis event was occurring. And then the treating team could then intervene and potentially stop or reduce clozapine. The other thing we need to do is see if we can actually manage people safely with anti-inflammatories or other agents. What we're also doing is developing translational models in the biological sphere. So we're looking at animal-based models and also cell-based models, so we can investigate new markers to predict bad outcomes early and also treatment outcomes early, but also to to understand better the mechanisms at the cellular level of how this drug works and is more effective than other drugs. And hopefully we can develop new treatments based on that in the future. What we've created is a unique embedded research structure where we can both forward and backwards translate from cells to animals to, I guess, the data that we collect at health services and right to the bedside.